Thank you. Mr. Kustoff.
Thank you, Mr. Chairman, and thank you to the witnesses for appearing today. Dr. Hoben, if I could with you, you've talked about it maybe on a couple of different occasions about remote patient monitoring and the importance. Can you talk about how remote patient monitoring fits into Novant's mission to improve the proactivity, if you will, of addressing chronic disease and chronic disease management?
Yes, sir. In chronic diseases, one of the great things we have is a plethora of data. And so when we have data from patients when they are in their home environments, we actually get longitudinal information rather than one-time information. So if you use blood pressure as an example, you may come to me with some anxiety in my office and your blood pressure's high, but at home, your blood pressures are normal while we're monitoring them remotely. So having access to that data allows us to make better treatment decisions and long-term decisions for that patient to improve their outcomes. The other key to that is managing that plethora of data, which means we have to create support mechanisms for top-of-license work so the nurses, care managers, and others can help us manage that data, leveraging the providers to really be taking care of the complex patients when their chronic conditions are out of control.
Can you talk about some other chronic conditions and maybe some, whether it's devices or wearables or what have you, where you're able to monitor those patients?
Sure. So in our hospital at home, for example, we've got devices that will measure blood pressure and oxygen saturation and other vital signs that are taken back to a care team that manages that care outside of the facility. So the concept is we have access to that real-time data. We can make real decisions, preventing complications and improving their outcomes.
Do you have any way of noting, if you will, when somebody needs the in-person attention, the fact that they will follow up and go into your facility?
Sure. So connecting to them electronically through our patient record is an easy way to do that from an access standpoint. So there's direct communication with their care team. They have access to generate not only in-person visits if they need to, so schedule an appointment. They can also do a virtual visit that's video that allows us to actually see the patient, see body language, sometimes see rashes and things that might show up.
Very good.
Yes, sir.
I could, on a different line, in your written testimony, you talked about a white paper from 2023, Making Annual Wellness Visits Work. And you talked about the time and attention, primarily the time, that a physician has to spend on electronic health records, and maybe up to 2 hours. Talk about how that takes away from your primary goal as a practitioner.
As you can imagine, our primary goal as a practitioner is to be with the patient, and electronic records have certainly been distracting at times. That's where it's really important to gain the efficiencies where we can in that tool. So in things like annual wellness visits, if I want to combine that with chronic conditions to be more efficient for the patient, there's a slew of additional codes that I have to know or remember or find in the electronic record that is quite challenging. So I think it's an opportunity to create efficiencies and leveraging the capabilities of these tools to simplify those codes we need to justify the time we spend with our patients, which is the valuable time to really improve and enhance their conditions.
You think you can do that and reduce the amount of time that you have to spend creating the electronic health record?
I think it's possible, yes. I think it also involves leveraging a team. And so I think making sure that I'm mostly spending my time with the sickest patients as the one who should be doing that work. And to your earlier comment on the remote patient monitoring, that may be happening by another skilled team member that doesn't quite need the expertise of the physician.
Thank you. Ms. Reichert, thank you for coming and testifying today. I know that all the practitioners are on the front lines, but you really are on the front lines. And the district that I represent is suburban and rural. I'm thinking about my rural pharmacists. I can hear Jason Kaiser or Derek Holyfield talking about the counseling that they spend with their patients. Do you have any idea the people you come into contact with that you counsel, how many or what percentage don't have a primary care physician where you're acting as their primary care physician in effect?
Thank you for this question. I don't have an exact number, but I can tell you that many of the patients I see in my pharmacy, we are their primary access point. And it may be that they come to us looking for a primary care provider, but unfortunately, in the area where we live, they are so scarce, and there's such a lack of resources that often they seek care at emergency departments or convenient cares or whatever it may be, and they really don't have that kind of home-based primary care provider.
Thank you for your service. Thank you, Mr. Chairman. I'll yield back.